Hi, and welcome back to Unmasking the Trans Movement with John Euler. I'm your host, Brad Wilder. Today on the show, John Euler, Dr. Ann Gillies, and Dr. Van Mol sit down to talk about the dangers of the trans movement. There's more to come right after these.
Do you notice a change in your child? Do you wonder what's going on with my child? Do you finally see something others have been seeing for some time now? Do you see the ideology and indoctrination after your child returns home from school every day? Do you see? Yes, you do see the harm and the confusion they are causing. Do you see the role they are playing on your child's life and development? Do you see? Yes, you see now. And now you have questions. At Unmasking the Trans Movement, we're here to help answer those tough questions you can't ask anyone else, or answers that are hard to find. We discuss the many topics of this evil agenda indoctrinating our children into a world of self-destructive deviance, constant medical care, and human degradation. Our webinars provide access to supporting groups discussing the tough issues you want to talk about with real parents and experts alike. Sign up and become a member now and you'll save 30% off your first-time membership starting at just $7. Select from our bronze, silver, and gold packages, all with different options depending on your needs. Our mission is clear: to unmask the deception and protect the most vulnerable among us, women and children. For webinar dates, times, and pricing, please visit our website at unmaskingthetransmovement.com/webinars.
Welcome back. Today on the show, John Euler, Dr. Ann Gillies, and Dr. Van Mol will discuss the dangers of the trans movement. The trans movement is being unmasked right here on our program, and we're bringing you every single bit of detail we possibly can to help parents, grandparents, and children alike. Thanks for being here today, everyone. Let's jump right in with all three of you, John, Dr. Ann, and Dr. Van Mol.
Brad, thank you. We have an extremely important topic and a very special guest. I'm very excited. I know Dr. Ann Gillies. Dr. Gillies, thank you for being back with us. We are talking about the dangers of the trans movement and what we have seen unfold, right, in terms of rage and now death. People are being harmed, not just kids, but innocent people are being harmed. This is now a public safety issue, and we have a professional that is wading into the waters along with us, and we're so appreciative. Ann, would you do the introductions?
I'd love to do that. Well, I want to introduce my friend, Dr. Andre Van Mol. He is a family physician in California. And Dr. Van Mol, you have been providing, you just are a wealth of information. I have, I don't have it here. I had it for an interview yesterday. I was doing your big packet of research, not just research, but how to find all the research that we need to understand this whole issue. I mean, you've written a lot. You have, you definitely do deep searches, and you know what's going on out there. You've also spoken internationally on this issue. You have so much information to share with us, and we welcome you. And today we're actually going to be talking about the brand new, well, let me read this. I'm Canadian, so I'll just make sure I get this right. Sorry about the noise. U.S. Department of Health and Human Services, Substance Abuse and Mental Health Service Administration, providing comprehensive overview of the scientific research and consensus that LGBTQ youth thrive when affirmed. So they have a whole new report out as of yesterday, just in time for the trans activist recognition. So let's kind of start with this report and yeah, take it away. I think John's maybe going to share this on the screen and just, you know, take it bit by bit and share whatever you like, Dr. Van Mol.
Great. Thank you, Ann and John, for having me on today. Yeah, this press release yesterday was just stunning in its lack of viewpoint diversity, the boldness of its error, I went through it and I found that I had more highlights on it than they had false information in it. But yeah, if I can just give a brief go over for your viewers. The title is New HHS Report Released on Transgender Day of Visibility Offers Updated Evidence-Based Roadmap for Supporting and Affirming LGBTQI plus Youth.
Dr.
Yes,
Dr. Baumol, if I might, and I'll bring it up on the screen. Would you, for our listeners, it's so important, I think, for you to be able to give your background. You are an actual physician with years of experience. As a matter of fact, you shared you were in the military. You were a flying medic. So you've had years of experience. We just had Dr. Cretella on. You all know one another. And so for our audience, just to really give context for your analysis, could you share a little bit with the audience your background?
Yeah, I'm a board certified family physician in full-time practice in California. I see patients all day. That's what I do. I was a Navy family physician and flight surgeon for a while, working with the carrier air wing in the case of the flight surgeon thing. But since I've been in civilian land here for about 28 years, again, full-time practice, but I have a strong interest in bioethics issues, amongst which this is the raging issue right now. I would say I've started getting hot and heavy, into researching this in 2017. So it's been about 6 years. In that time, I've testified for legislatures, parliaments. I have sent in written testimony to I don't know how many states and countries on different issues when they come up in bills, dozens and dozens. I write for the Christian Medical and Dental Association. I'm one of their national bloggers. I co-chair their relevant committee on this subject. Likewise, for the American College of Pediatricians, I co-chair their relevant committee. And I also work with the world's largest organization of its kind defending First Amendment liberties, Alliance Defending Freedom. So yeah, I'm up to my eyebrows in this and what's going on with it. In the case of working with ADF, I'm part of small teams writing amicus briefs that go to circuit court and Supreme Court cases. Was just received an email right before I came on with you of another win with the 11th Circuit in the state of Florida, trying to protect women's spaces in school that they'd really be for women. So I have dirt under my fingernails from what I'm telling you about. This isn't stuff off the top of my head. I'm experienced in it. And in a manner of speaking, I'm not asking your audience to believe anything that I haven't gone in and done already. So it's not weekend warrior armchair quarterback stuff. Hope that's a sufficient intro.
There you go. Let me ask one additional question before we then have your analysis. We'll go line item by line item. I actually reviewed it as well, and it's just stunning, and it's propaganda, quite frankly. But what message, Dr. Baumol, let's say we have parents that, parents are busy. You and I, we're all Dr. Ann, right? We have a certain parent in mind. There's a couple different kinds of parents, but let's say the average parent has been busy little by little, the trickle effect, and they find themselves, they're not sure, but it's like, okay, whatever this pronoun thing is, whatever this non-binary thing, whatever, and so they're becoming a little familiar, but through the spin of the media, what would you say to parents that, let's say they are protective, but they're just naive? It's happening in churches as well, right? This whole push. What would be the message so that as we turn to this document and we're going to unpack this and we're going to parse through this, what would be the message that you have for parents as far as the dangers of the trans movement and all of this kind of bundled up together? What would you want them to know?
The most straightforward thing to know is there is always a more honest answer to gender confused kids than chemical sterilization and surgical mutilation of healthy young bodies. I can't put it much more simple than that. There's other things to know about the problem of gender dysphoria, transgenderism. Decades of studies showing the overwhelming probability of underlying mental health problems, adverse childhood experiences, dysfunctional families, and an unusually high percentage of autism spectrum disorder. And it's those underlying issues that should be dealt with, not experimental, not proven safe, not proven effective gender transition procedures.
You are succinct. So with that note, and so I hope every parent heard it, this is diabolical. It's unnecessary. It's just horrific. So, okay. So we have a new propaganda piece. I'm going to share the screen. We will bring it up. I think I have it. There we go. So doctor, this is again, HHS, healthandhumanservices.gov, hot off the press today, I believe. So do you want to read through it line item by line item?
When you brought it up, you took away my notes.
Oh, I
my
did.
My field is dominated by this.
Okay, well, I'll stop sharing it. We will then ask Brad to bring it up. I don't really know how to do a split screen. We're all professionals and the people helping here, Dr. Wirth. Okay, so we will, as a matter of fact, you start talking about it. We'll figure out a way to bring it up. Brad and I'll do that kind of as you're talking about it. How's that? So if you want to actually just read through it, then
okay. So are you gonna
take
it off the screen now? There you go. Thank you so much. Hope that's not an inconvenience for your audience, because it's tiring if we're reading the whole thing and someone else sees it. So I'm just gonna go through some highlighted stuff in the first paragraph. It talks about these LGBTQ youth can be resilient and thrive when they're supported and affirmed, but they claim that pervasive discrimination, rejection, and bullying has led to a nationwide mental health crisis. Everything's wrong with that.
Oh, yeah.
Again, the mental health problems underlie it in the first place. We have 4 or 5 great studies out of the US, out of Western Europe, out of Australia, that show that the problems predate any identification with gender dysphoria. So they were there first, not the other way around. And as for the bullying thing, of course, this pulls at the heartstrings. Nobody wants to be bullied, but the fact is everybody has been bullied. Bullying is a universal experience. I mean, find someone that was never bullied in their youth. So it's not unique to sexual minorities. And a study out of Finland in 2021, and it was a large nationally representative sample, and those are rare, found this. We found that transgender identity was generally associated with perpetrating bullying, and that the association was stronger than that of transgender identity and being bullied. So they're kind of turning reality on its head here. It says here these kids are put at risk by policies that seek to restrict their access to appropriate healthcare and inclusion. No, sir, no, ma'am. What's happening is they're being decoyed into thinking they have to go through gender transition procedures, be it social, puberty blocker, cross-sex hormone, or even surgery, in order to be put straight. And that is certainly not the case. And if any access to proper care is being restricted, it's the restriction against being able to get the mental health evaluation and support that they need. And I would remind your viewers, the UK, Sweden, Finland did comprehensive literature reviews, and those are rare things that cause them to do a 180. They're not doing this gender affirming care as a first line thing anymore. They are strongly emphasizing psychological evaluation and support for both the child and family. And the reason is clear, as we previously stated, there are going to be underlying mental health problems, family dynamic problems, adverse childhood experiences, even in the best of homes. That's what these kids need to have made available, but I'm quite confident that the majority of the mental health professionals in the West are afraid of being accused of conversion therapy if they try to deal with underlying mental health problems. So the Biden administration has that backwards. Next paragraph. They talk about that it's normal and healthy for children to identify as LGBTQI+. No, those are ideologies. For all of human history, sexuality was a verb, not a noun. It's what you could do, but not who you were. It was behavior, not identity. So the idea that it's normal and healthy to have an ideological preset like this, I disagree with. And if it's normal and healthy to sexually express this way, why all the bad healthcare statistics that the administration is trying so hard to blame shift onto society at large? It's just not supportable. They say all children should have their sexual orientation and gender identity affirmed and supported. The medical literature is clear. Do not prematurely affirm. The 2014 APA Handbook on Sexuality and Psychology has several sections on this, how critically important it is not to affirm off the cuff because there's homework to be done. What's going on underneath this? A 2020 study by Withers said that quite often, trans identification is an attempt to evade the pain from underlying mental health problems. Next thing they do here at the close of that paragraph is they say so-called conversion therapies are never appropriate for youth, are ineffective, and can cause significant harm. False, and I know you both are very familiar with the literature here. The literature claiming harm always makes the same mistakes. It's flawed data. And in fact, we have several studies just in the past few years showing just the opposite. I'm going to real quickly give you a thumbnail on those. First of all, the APA's 2009 task force report is commonly misquoted as saying it proves harm. And they say specifically on several different pages that in fact, in their estimate, the quality of the literature on the subject is so poor that they cannot claim efficacy or non-efficacy, help or harm. So they're specifically saying, we don't know based on the level of the data. So to turn around and say that proves harm is quite a stretch. But to be quite specific here, 2021, a study by Professor Paul Sullins found that change allowing counseling strongly reduced suicidality. The 2021 prospective study by Pella and Sutton, the best of its kind, found that therapy can be effective, beneficial, and not harmful. 2022, another study by Professor Sullins that he called a stress test of this theory that it causes harm, found that even people who failed completely in therapy trying to change their primary orientation, if we can call it that, still did not suffer higher psychological or social harm. In fact, they came out of it feeling better about themselves, completely the opposite of what we're being told. And then in 2022, Professor Schum did a confirmatory study, a really high quality analysis looking at several different levels of proof and the whole mathematical wizardry, and found that harms from sexual orientation change efforts seem to be minimal compared to the positives reported by young adults. And he says, additionally, even for study subjects whose same-sex identification and behavior became stronger, they nevertheless reported higher levels of helpfulness from the therapeutic efforts. So there's nothing to support what they're saying here. And then they go
Dr.
on to say, yes, go ahead.
If I might, it was a great phrase that you read from one of those studies, change permitting therapy.
Yeah,
to think that we're in a day and age now where we have to make the case that it's okay to permit change permitting therapies. The reason somebody's come to therapy is because they're stuck.
Yeah.
In one way or another, they're out of their own resources or answers, and they're stuck. It ain't working for them. So if you can't permit change, then you've really consigned them. We're useless, quite frankly. And that's really what, in the trans deception, they're just viewing us as gatekeepers. The whole thing is about change, trying to figure out what works for them, what's going to be in alignment with their values and their core sense of self. Well, if they don't have one, probably something happened to cause them to lose that core sense of self. So to say, right? So it was very interesting when that term, change permitting therapies. That makes,
and
right?
the whole, the weaponized language that they use on the other side and the antonyms. And, we really have to fight for meaning of words, because if we use their language, we're already painted into a corner. But, we keep hearing that, making kids get mental health counseling instead of gender transition procedures, that's conversion therapy. Well, I can't think of anything more conversionary than the chemical sterilization and surgical mutilation of a young body that's healthy, but for sake of a mental health problem. They got it upside down.
Dr. Baumol, one other question.
Yeah.
As far as the length of time on the puberty blockers, you're a physician, so here's the medical question. About what span of time would a child potentially end up, not potentially, will the sterilization process take place? How soon?
Well, yeah, that's the question. And it's kind of hard to answer because, usually you'd think maximally the kids are on it for 5 years. then they swap over to wrong sex hormones, which they call cross-sex hormones. Well, the whole time that they're on the puberty blockers, the sperm and egg are denied the opportunity to mature, right? So if you're on the puberty blockers long enough, they don't. But if you follow puberty blockers with cross-sex hormones, you've guaranteed sterility. The sperm and eggs never have a chance to mature. And that's on the consent forms that we were able to get with a lot of legal effort and arm wrestling, for example, from California's Children's Hospital, Los Angeles. It's right on the consent forms for the kids and the parents, saying, so you'll be sterile. UC San Francisco's transgender clinic is even on their website, talking about the serious conversations that need to happen about sterility. And of course, as a UK High Court said in the Bell versus Tavistock decision, there is no age-appropriate way to explain to some of these kids what losing their fertility and sexual function means. And the simplest way to make people understand that is get a group of 15-year-old kids together. Ask them all, hey, how many of you want to be married and do you want to have kids and how many? You get one set of answers. Ask them again at 21, ask them at 25, ask them at 30. A 15-year-old just can't project those kind of things. The young mind's developing, immature, it doesn't understand long-term consequences. It's given to risk-taking and groupthink and peer pressure. There's no way a kid can give, proper informed consent to these kind of life-altering procedures.
This really brings up something that Dr. Catellan was talking about yesterday that really hit me, because in Canada, I don't think we're doing this yet, although I could be very mistaken. But she was saying that children as young as 8 are being put on, and it's like a cocktail, both puberty blockers and hormone therapy. They can do both at the same time. Well, what 8-year-old? I mean, even if you just do the puberty blockers from 8 till 14 or 8 till whatever, 8 years old, I'm like, oh my goodness, this is so abusive.
The average American and the average American legislator have no idea that's going on. And what you're referring to is specifically that $5.7 million National Institutes of Health study being carried out in 4 centers: Los Angeles, San Francisco, Chicago, and Boston. And what Michelle was showing you is the letter that Johanna Olson Kennedy of Children's Hospital, Los Angeles, requisitioned the NIH to be able to lower the age limit from 12 to 8 so they could get more subjects. They were having trouble getting enough people to participate. My endocrinologist friend Michael Laidlaw presented this information in Washington, D.C. to a group of legislators. They didn't know about the 12-year-old part. And this was a group of legislators who were also physicians, so senators and congressmen. They were angry enough about that. And then he goes, oh, no, don't be angry yet. And showed him the update document. It's being down to 8 years of age. They were infuriated. It led to a letter signed by 28 senators and congressmen that went to the NIH demanding answers.
Well, we have got to be able to become irate at what's being done to our youngest. Like these are little children, 8-year-olds. I can't even begin to imagine an 8-year-old being put on such drugs and experimentally, right? Because they want more numbers. Hello. Actually, I was going to say something. Norway just recently has put out a document that they are going to maybe require that puberty blockers be listed as experimental. Did you see that?
Norway has done the same kind of 180 that the UK, Finland, and Sweden have done. And just today, I read that in Belgium, the director of their evidence-based research unit said, as far as he's concerned, the evidence supporting the WPATH recommendations on puberty blockers is so low that if he were reviewing it, he would have to throw it in the bin.
Wow. Okay, we need that out there everywhere, don't we?
Yep.
Good for you. Well, anyways, I won't stop you anymore.
Keep going. Right? It just makes your blood boil. This is such Nazi-like experimentation and profiteering.
Oh, it's the worst possible face of capitalism. Oh man, the pharmaceutical firms, the biotech firms, the hospital chains, the insurance companies, they're all in this, and the lawsuits have started. They're going to get a chance to pay for what they've done.
I hope so.
Yeah, so continuing on page 1, everyone should be able to be who they are and access the care they need. Well, we're not talking about who they are, we're talking about how they are here. Again, this identifying with stuff is ideological. They use the phrase transgender youth. And I would remind you that, Professor Ken Zucker, who for all those years headed up the Toronto Gender Clinic, said that the term transgender identity is hardly an objective label for a child's gendered subjectivity. But again, it's weaponized language. The administration on the next page, brags about helping prop up the 988 suicide and crisis hotline, and that they want staffed with counselors trained to support LGBTQ youth and adults. It's like, I'd rather have counselors trained to prevent suicide than those
There it
who
is.
would
Thank
lead
you.
kids into ideology.
That's why we
again-
have concerns. I have huge concerns about the Trevor Project. Exactly
Oh,
that kind of
goodness,
thing.
yes.
It targets that population as far as overlaying it with sex and sexuality. And, people did a mother, it was Epic Times kind of revealed that a mother did a test, right? She feigned being a young teenager to find out how would this texting back and forth go. And quickly, the adult on the other line introduced the issue of sexuality. How do you feel in terms of your gender?
Yeah. So
Well,
kids
the
are being
Trevor Project.
coached right into it.
The Trevor Project has incredible loopholes and just misinformation and bad science, bad research. But I mean, it's out there, and it's what our government in Canada, one of the big things that was used to solidify the whole conversion therapy bans. There you go.
Yeah.
Anyways.
Yes, indeed. Moving on, they repeat themselves on, change efforts, SOGI change efforts being harmful. You must affirm. Gender affirming care supports health and well-being. And then they say, gender affirming care is a highly specialized model of care that uses evidence-based practices and is highly individualized. Absolute nonsense. They just got through telling us you have to affirm on demand. How can you walk out of a gender clinic? How can you walk out of Planned Parenthood after a 30 or 40-minute visit with a prescription for cross-sex hormones if all this stuff's being done? There's nothing highly specialized about it. It's a bumper sticker sales pitch. It's affirm or else. And then they go on to say, appropriate to age and developmental level. Well, WPATH Standard of Care 8, SOC 8, and by the way, just because they call them standards of care doesn't make them so. SOC 8 removed all age restrictions for puberty blockers, cross-sex hormones, and surgery. So everything they've just said in this paragraph here is ridiculous. And then they say, decisions about providing gender-affirming care are reached when the involvement of an adolescent's parent or legal guardian. I've seen that disproven in state after state. I mean, parents are complaining that the schools help their kids transition under the parents' noses without their knowledge. In California, they've already passed laws that, down to age 12, nobody has to inform the parents if a kid wants to transition. Same with abortions and stuff. It's just not evidence-based medicine. It's radical ideology. Then they say effective therapeutic approaches support youth without seeking predetermined outcomes.
Oh, gosh.
You just got through saying paragraph after paragraph that there's a predetermined outcome. So, it's pretty silly. Again, talking about stigma, rejection, and discrimination being the cause. Stigma is not the cause. I put together some quick stuff for you here. 2016 study out of Canada's Toronto Gender Clinic looking at 40 years of data said once we controlled for general behavioral problems, poor peer relations, by which they mean stigma, was no longer a significant predictor of suicidal ideation and behavior. There's 3 different meta-analytic studies looking at that strength of relationship between stigma and mental health. And they show the association was less than 9%, not 19, not 90, less than 9. Out of the Netherlands, looking at 50 years of data, they said quite specifically, increasing cultural acceptance has made little difference in suicide rates among the gender dysphoric patients, suggesting stigma is not a sufficient explanation for suicides. And Professor Michael Bailey, who's very gay identified, very well known in the sexual research field, he says the minority stress model was prematurely accepted before it was ever tested. And he thinks, get this, one rival hypothesis exists that the increased prevalence of mental health problems in non-heterosexual persons is at least in part the cause rather than the effect of increased self-reported experience of stigma, prejudice, and discrimination.
Wow.
So it's a bumper sticker slogan of them. They write it to great effect, but it's just not holding up to scrutiny.
That's a really powerful statement that Michael Bailey made. My goodness. Will you read that just one more time? That's just, people have to.
Yeah. He says, regarding the minority stress model, at least one obvious rival hypothesis exists, that the increased prevalence of mental health problems in non-heterosexual persons is at least in part the cause rather than the effect of increased self-reported experiences of stigmatization, prejudice, and discrimination. But of course, if you say that, you're a hater, a bigot, and a phobe, right?
Yeah, well,
Yes.
we've just quoted somebody that has his own degree, Dr. Bailey has his own degree of sexual deviance, like I've reported on, but so all the more. So you have somebody that really has pushed the bounds, Dr. Bailey has, as a sexologist, yet he is warning. So when you get people from a lot of different perspectives saying, listen, this thing is not, there's other causes here, then people need to take note. And this is a subject, this is an issue that all good people should be able to come together on, which is the protection of women and children against exploitation of this kind of stuff. And Dr. Von Moll, I'm aware of the fact that we are up against the clock for this first segment. Would you be willing to stay with us?
That'd be great.
Okay, we will do a deep dive into more of the concerns of this document that was just put out by by HHS, and then we will look at some of the additional concerns of puberty blockers and cross-sex hormones, and even what may have been contributing factors with this the shooting that happened in Tennessee. So thank you. You stay right there, Dr. Gillies. Thank you as always.
We'll be back.
We will be back. Brad, thank you as always.
Thanks, John. Thank you, everyone, for joining us today. Dr. Van Moll, we appreciate every word of wisdom that you've brought to the table today. Dr. Ann Gillies, as always, a pleasure to have you on the show on a regular basis as co-host. And John, well, what can I say? We started this for a purpose, and the purpose is to help parents, help grandparents and children alike get educated on what this trans movement is all about and how evil it truly is. Remember, you can find us at our BitChute channel, Unmasking the Trans Movement, or see our website at unmaskingthetransmovement.com. All kinds of resourceful information found there for parents, grandparents, and children alike. I'm Brad Wilder. Remember, it's not your kids' fight, it's our fight. I'll see you next time.